Can beta blockers prevent PTSD after trauma? Imagine a medication that might help keep traumatic memories from becoming overwhelming. That's what researchers are exploring with beta blockers like propranolol. These drugs are primarily used for heart conditions, but scientists are investigating if they can also prevent post-traumatic stress disorder after a traumatic event. When someone experiences trauma, their body releases stress hormones that help from strong emotional memories. Sometimes, these memories become persistent and distressing, leading to PTSD. Beta blockers work by blocking beta-adrenergic receptors, which are involved in the stress response and memory formation. The idea is that by interfering with this system, propranolol might reduce the emotional intensity of traumatic memories, potentially preventing PTSD from developing or lessening its severity. Studies have shown mixed results. Some clinical trials have given propranolol shortly after trauma or during memory reactivation sessions and observed reductions in PTSD symptoms. These include decreases in heart rate and skin responses, which are signs of physiological stress. However, other studies have found that the improvements with propranolol were similar to those with placebo, meaning the drug's effect might not be dramatically better than doing nothing. The timing of administration seems important. When given soon after trauma, especially during periods of high psychological stress, propranolol may disrupt the process of memory reconsolidation. This is when memories are restored in the brain, and interfering with this process could weaken the emotional grip of traumatic memories. Conversely, for individuals with long-standing PTSD, propranolol appears less effective because their memories are already well consolidated. It's also worth noting that propranolol seems to target emotional memories specifically, without affecting neutral memories. This targeted action supports its potential use in trauma-related conditions. Sometimes, it is studied alongside behavioral therapies like exposure therapy, where it may help reduce fear responses and improve treatment outcomes. Despite these promising signs, propranolol is not yet a standard treatment to prevent PTSD. More research is needed to determine the best timing, dosage, and which patients might benefit most. It's important to remember that beta blockers should not replace established therapies but could be used as an additional tool under medical supervision. In summary, beta blockers like propranolol show potential to help prevent or lessen PTSD symptoms by altering how traumatic memories are processed. They seem most promising when given shortly after trauma or during controlled memory reactivation sessions. However, their effectiveness varies from person to person, and they are best used as part of a comprehensive treatment plan. Anyone considering this approach should consult healthcare professionals to get personalized advice, as medical decisions should always be tailored to individual needs and circumstances.